Good afternoon. I'm Gaurav Agrawal. I serve as the Chief Wellness Executive for Northwestern Medicine, and I am a psychiatrist. I'm joined today by Dr. Kirk Brower, Dr. Brower, thank you for being here with us today, and I'd love it if you'd introduce yourself as well.
Thank you for inviting me. I am also a psychiatrist, and I work at University of Michigan Medical School in Michigan Medicine, and I am the Chief Wellness Officer there.
Thank you for joining us today, Dr. Brower. I wanted to just start with a little quote that I think will highlight a little bit about what we hope to learn from you today. And this is from Dr. Kay Redfield Jameson, who wrote An Unquiet Mind and her story about living with bipolar disorder. And she had said it was difficult to make the decision to be public about having a psychiatric illness, but privacy and reticence can kill. The problem with mental illness is that so many who have it, especially those in a position to change public attitudes, such as doctors, lawyers, politicians, military officers, they're reluctant to risk talking about their mental illness or seeking help for it. They're understandably frightened about professional and personal reprisals. And I think what she's really getting at is this idea of the stigma around disclosure of mental illness and how that has been at least one of the major barriers in people in the healthcare industry being able to seek care when they've needed it. And I think she's highlighting that there is this belief that disclosure would be very useful in dealing with stigma. And I think that we've learned that you have used that tactic to help with stigma in your community, at your system. And was wondering if you'd share a little bit about your approach to self disclosure and your story.
Yes, it's such a good question. The stigma of mental health is such a big issue, and if by sharing our stories, someone can identify with and benefit from that sharing, then that's appropriate time to disclose. So it's both knowing what to disclose, when to disclose it, and with what in what venue. We currently are in a time in our society where a lot of people are disclosing a lot of personal things, and um, and sometimes the reason is not necessarily to benefit others. Thinking of some celebrities who use various platforms, and some of it may be publicity. But I do believe that people can benefit. Let me go back to an experience I had as a teenager. When I was about 16, I had an older brother um, who came home from his first semester in college due to a mental illness. He had a very severe form of obsessive compulsive disorder and uh, spent hours and hours each day washing his hands and preventing contamination from germs. And this was at a time before our pharmacological treatments. And um, but the point I want to make here is that he wanted to be sure that nobody knew about it. And so our family didn't, and he essentially lived at home. He was too disabled to go back to college or to do anything else. So, and our family honored that. Um, so that in a way we isolated and cut ourselves off from the people who really could have supported all of us, including other families and our own extended family and friends and so forth. Um, Back then, this was a while back, in the uh, late 60s, early 70s, we still had stigma about cancer. Cancer was called the C word. And if you had cancer, you didn't tell people about it. So mental illness was way behind in terms of that status. Um, so I think that was a very powerful early experience that I had with stigma, and um, and because of that experience, I actually grew up with the same reticence and resistance. So I understand where that's coming from. So if today, if I can, one person can benefit from my story, then I will have done my job.
It's a fantastic point and a fantastic reminder that you know people speak openly about cancer now, and so there is a path forward, and we have seen this sort of change happen, and there's no reason it can't happen for mental health the way as you describe it has had for cancer. So I think that's a great reminder and a hopeful reminder for us. Uh, would you mind sharing a little bit about your story now?
Well, sure. So I'll continue with that story. So my brother died by suicide when I was 17. And so there was also a lot of shame and stigma around suicide at that time. We described it as committing suicide, as if we were, anyone who died by suicide was committing a sin. And certainly in certain religions, it was considered a sin, and still is. So again, this was something that you didn't talk about. And so going forward for a long time, people would say, well, do you have any brothers? And I have a younger brother, so I would say, yes, I had one younger brother. But I wouldn't disclose that I ever had an older brother because then I would have to say, well, what, tell me about, right? So that stigma followed me for a long time. Um, when I was 17, my brother died by suicide, and I found his body. So it was also a very traumatic situation for me. And so I did not yet know, I didn't even recognize, I'm not sure the American Psychiatric Association recognized, in fact, I know they didn't, post traumatic stress disorder.
Right.
Um, but I lived every day with that memory. I thought about it every day for probably about 10 years, but I didn't think of it as a mental illness.
Mhm.
Right? Um, I just thought of it as this is how people feel, ashamed, not wanting to talk about it, yet thinking about it every day.
I'm really sorry your family and you had to experience that.
Yeah. Um, I think I think the other thing that happened was when I went to college, I was afraid because my brother went to college. He came home. He died. And I was thought, maybe not even so consciously, is that going to happen to me?
Mhm.
Moreover, my brother was in treatment. He did seek a psychiatrist. It's just that our treatments at that time were not adequate. Um, but it prevented me from seeking treatment because I thought, oh, well, if you have a problem, you go see a psychiatrist, you're going to end up worse than when you started.
Yep.
So I think, that's another resistance that I had when I developed my depressive disorder, um, that I was afraid to go see somebody.
Yep. And then when did that change? When were you able to seek help?
So it changed when I went into psychiatry. And and I think, part of the reason I went into psychiatry was, to help process this. Um, I'm going to use a stigmatizing term right now, which is crazy. But I'm going to do so for a purpose because I think, I heard a lot about how, you know, there going into psychiatry when I went into psychiatry was itself kind of a stigmatized profession. And one of the comments people would make is, well, people go into psychiatry because they're just trying to work out their own problems.
Yep.
Um, but what I realized was, what's wrong with trying to work out your own problems? And in fact, aren't we all trying to do that all the time, whether you go into psychiatry or surgery or, so working on your own problems is not the issue. But I had the guys at that time in training, all psychiatrists were encouraged to be in therapy themselves because in order to understand the experience of being a patient and to prevent us as psychiatrists from um, saying things that were due to our own issues to patients, um, it was considered helpful. And indeed, it was helpful. So that gave me a cover reason to seek treatment. Of course, what I really needed to do was to process my brother's death by suicide, and a lot of my first course of psychotherapy was doing just that.
Interesting. And you highlight how many different forms stigma can take, right? And I'm a little earlier in my career than you, and uh, I'm happy to say it's better, but it was still a part of my decision making to go into psychiatry. So there's that stigma that we have about our own field internally that limits really talented medical students from going into this field because they're having to think about some of those things. Is what are other people going to think if I go into it? And so various aspects that we all have to overcome so that we can overall improve access to care. So I appreciate you sharing that. When did you? I'm sorry. When did you feel um, ready to share with other people that you had received treatment, and what led to that?
Um, well, first I decided to share it in writing. I was asked, I don't know, it was probably, well, at least 6 years ago. So it was kind of recent. I didn't really share these things with others, but I did begin to share them with people I felt close to, meaning not just my family who knew, but with friends. But it was always on a one-on-one situation. Um, there was a congressional hearing. Well, it wasn't a congressional hearing. It was a panel that was asked to speak before congressional aides. So there weren't congressmen there, but there were aides there. And the American Psychiatric Association was involved. Um, and I was asked to speak at that panel um, about, and I don't even know how this came about, but what I talked about was the experience of being a survivor of suicide.
Mm.
And so I kind of wrote out the story and I gave the story there, um, with the idea being that um, I think when people do decide to take their own lives, they think that everyone will be okay afterwards. They'll get over it. They kind of have to minimize the impact, and their depression helps them to minimize that impact in order for them to take their own lives. Um, and so one of my messages is that no, we don't get over that. And I talked about what the experience was like. And afterwards, I received all sorts of emails from people who I assume were there. I don't think this was broadcast anywhere, saying, "Thank you for sharing your story. That's been my experience. You put it to words for me." And I thought, wow, maybe I can take this experience and turn it into something that would be helpful to other people.
And then you said you turned it into words.
And so yes, and eventually what I said there, what became a piece in Psychiatric Times.
Hmm. Okay. And what was the reaction to that piece?
Um, you know what? Now that I think about it, that might be when I received all that feedback because that
Hmm.
was more public. At that congressional aid meeting, people did come up to me afterwards and say that they admired my courage for sharing my story. Um, and and there might have been one person who had was able to identify with it. But
That's
yes,
great.
the emails came after psychiatric terms.
That's great. And I don't think I actually had you share what is your role uh, at the University of Michigan.
So I'm on faculty in the Department of Psychiatrist. I am a psychiatrist, and I subspecialized in addiction psychiatry. And most recently now, I am the chief wellness officer for University of Michigan Medical School and faculty director of the wellness office.
Mm-hmm. And then in that role, have you ever felt that self disclosure around these issues would help uh, the people that you served at the University of Michigan? Have you used this story internally as well?
Yes, I have. I think, during the initial stages of the pandemic, um, I was asked to be part of a town hall that the executive leaders were doing and to speak to, um, the way people were feeling, their emotional response to being not only part of the pandemic, but part of being on the front lines of taking care of patients with the pandemic. And so I started talking about what would be normal feelings to have. Um, and that, people would have anxiety, they would have fear of, catching the disease, they would be fearful for their families, they might feel guilty about the people they couldn't help, they might feel, ashamed because um, they might be somebody who could contaminate their family, those kind of things. Um, and so I started talking about help seeking, that if you have these emotions, most of them are normal, but if they start to interfere, then it's helpful to talk with someone, talk with anyone um, who you know. And I also said, and if it gets so uh, bad that it's persistent, and you may want to talk to a professional. And I said, and I've done that before, and I can tell you that it was very helpful for me. So now we come back to the crazy. I said, you if you go to see somebody for help, it doesn't mean you're crazy. In fact, you'd be crazy not to.
That's great. That's great. I know that sometimes people say, "Hey, it's easier to talk to people you know versus put it out there in ether." But I actually have found personally, and I've heard this from others, when you publish your story in Psychiatric Times to the unknown faces, that may have actually been some that can be easier, frankly, than to disclose to people that have known me for the last decade. This is an aspect they didn't know about me. Did you feel the same way, or was it harder? Was it easier to speak to your internal community?
Um, yeah, well, that's a good question. I remember. I think what helped in terms of speaking more one on one with people was to learn how to talk about it.
Mhm.
So I remember I would sometimes, I went from not wanting to even say I had a brother to saying, oh, yes, I had an older brother. He passed away. Well, what happened? And I would say, well, he died from a mental illness. Um, and some people kind of knew what that meant, and other people thought that that was a funny way to talk about it.
Mhm.
So I had to go from died from a mental illness to died by suicide. But it was only after reading a very influential book written by survivors of suicide who talked about the language around it and how we needed to start using the term died by suicide as opposed to committing suicide that I was able to take that on. So I think once I had the language for going public, it made it easier.
That's a great tip. That's a great tip. Obviously, you have a very prominent role, leadership role. After you shared your story, did you feel what kind of feedback did you get? Did you feel any uh, negative reprisals from leadership folks looking at you differently in any way?
Well, I remember coming down from that stage in the town hall, and it was actually in person, even though it was during the pandemic. And one of my surgical colleagues and leaders, he kind of caught my arm and says that was great. And of course, only someone like you could get away with that phrase. You'd have to be crazy. So yeah, I got very positive feedback about that.
That's great. That's great. I think it just it shows the power of vulnerability and obviously the power of appropriate self disclosure. Any other tips you might have from or advice you might have for a leader who's thinking about sharing their story in the service of exactly what you did to encourage others to seek care, to normalize the fact that this is a human experience that many of us share. Any tips you might have for how a leader might do that in an effective way that is also healthy for them, right? We don't want to force people to do this that aren't ready to do this.
Right. There's a way to tell stories. In addiction psychiatry, I actually learned a lot from AA or Alcoholics Anonymous. There's a story about what I used to be like, then what I was like when I first started my recovery, and then story about, where I am now. And that you end with hope, that there's hope for having these kinds of experiences, and not that we get over them, but that we learn to live with them better, um, and that we learn to cope with them better. And that for some people, that path is going to be through professional treatment. Um, so I think, that ends up being the message. But in terms of tips, right, in psychiatry, we're told not to disclose.
Okay.
That's an important lesson. And what I had to learn was even with patients, and I'm obviously not an analyst, but even with patients, sometimes um, disclosure is important because that's going to benefit from somebody. That's going to benefit someone, or to withhold might be detrimental.
Mhm.
It's not about me though. It's not about, um, gee, I went through this and now I'm great, and aren't I great? It has to be um, about your audience.
That's great. Uh, did you notice anybody else that disclosed after you in the months ahead? Did you see anybody also share their story, a fellow leader, etc., come up to you and tell you about their experience?
Yeah, so I think, one of the things the pandemic has done by highlighting burnout is people can more easily identify with burnout stories. That's more, in a way, kind of socially acceptable. So people would start to share their burnout stories, and I have my own burnout story, so I shared that first as well. Um, and we then organized through the wellness office um, a webinar called Humans Before Heroes,
Mm-hmm.
because we were all being held as heroes. And we found a few people who were willing to talk about their experiences from burnout or depression to, right, healing. And so talk about those journeys. And We got very positive response. Um, we did rehearse it ahead of time and to help those people feel comfortable in sharing the stories. Um, and I think, if you're planning to do this, it can be helpful to talk with people who've done it.
That's great advice. I like that. Humans before heroes. I think that's what the all of this has been about is what's our human story and sharing it with each other. Well, I appreciate you taking the time with us and sharing your story, Dr. Brower. I think, as you said, uh, it will help others to be able to continue to change this culture, decrease the stigma, and sort of end up the way we think about even cancer now. I'd love to see that for mental illness in the future because I do think that will help so many more people be able to get the help that they need and to recover. So I appreciate you taking the time with us today.
Well, thank you for inviting me. It's my pleasure to be here.